When I went into nursing, I had no idea that this was where I would end up at the end of my career. Being in technology, there's always something new to learn. It allows me to use my nursing background as far as how the technology will be used by a nurse or a physician, and then also seeing how it impacts the patient. So it is a very dynamic job. Our information services team is about 190 people. We have a very diverse team, and we actually have a large number of nurses and clinical staff in IT that do support for the nurses and docs here. I like to hire nurses because I think they are well-rounded. They know all the operations at a hospital. They're the only people who have interaction with every single department. They are very good troubleshooters, and they're excellent educators. We have nurses in manager roles in a lot of our clinical implementation teams, and it's for some of the same reasons. Nurses have the ability to talk with other executive leaders in the organization. They have a way of persuading physicians to be able to participate in certain activities. They are very understanding and have a good idea about mentorship. So you'll see a lot of nurses in IT doing different roles, but management is certainly one of those key roles that they do. The bed boards have two components. One is to help monitor patient throughput and patient placement into beds. The second aspect of the bed boards is more of a clinical aspect to provide real-time alerting to nurses, physicians about clinical indicators that might be going on with the patients. The folks that work in mission control nursing services, they can actually see the inner workings of the entire hospital and what's going on that day. We also have a similar setup in our executive conference room that allows the executives to know what's going on those units so they can actually interact in a real-time mode versus waiting for someone to call them about maybe a particular issue. Any computer in the hospital has access to it, so you can see anything you need to see at any point in time on any unit. There's a lot of things that are going on in that one screen that if you're looking at it from a big picture, you can say, oh, that looks like a trend. Maybe we should do something about that. We're the only pediatric facility that utilizes this technology, which has been a huge win for our teams because it saved them a lot of time and a lot of effort that they were spending on walking around. Now they can put that back into patient care. We had a very large team of representation from all the different specialties in nursing to help us translate what would be important from a pediatric perspective and what were the things that were universal regardless of age. One of the things that we were the first to do was the pediatric early warning icons. So at a glance, we knew from a whole hospital perspective which kids were at the highest risk for potential issues. In 2013, I was named one of the top 100 CIOs in the United States across all industries by Computer World. So it wasn't just healthcare, it was banking, finance, and there were only, out of the 100, 8 people out of healthcare. So if that shows kind of magnitude, it is a great recognition for this organization, but also for me personally. As a nurse, to be on that list with people who are very technical is a great accomplishment. Don't limit yourself. There's just lots of other ways that you can use your nursing background and your skill to provide patient care in a different way. I would not change anything that I've done in my career, especially getting my nursing degree, because I think that really was the foundation of getting me where I am today.